Hi, everyone. I'm Lindsay Clark with the Alliance for Aging Research, and I'm honored to present the Partner with Heart Award to Andrea Baer, Executive Director of the Mended Hearts, Inc. The Partner with Heart Award is given to recognize a heart valve disease awareness day partner who has shown exceptional dedication to spreading the word about the importance of heart valve disease risk factors, detection, and access to appropriate interventions. This award honors the Mended Hearts for going above and beyond in their outreach and impact since the first Heart Valve Disease Awareness Day 5 years ago today. If you have ever had a loved one with a heart condition who had to be in the hospital, you've probably heard of Mended Hearts. They're the largest peer-to-peer heart patient support network in the world, offering hope and support to patients and their family caregivers for 70 years this year, and providing more than 200,000 visits annually. Mended Hearts and their sister organization, Mended Little Hearts, have over 200 chapters in North America, which serve more than 300 hospitals. Andrea Baer has been a part of the Mended Hearts organization for 12 years when she founded Mended Little Hearts of Southwestern Pennsylvania, shortly after her son was born with a congenital heart defect in 2009. Andrea held a variety of roles, including Director of Patient Advocacy and Vice President of Mended Little Hearts, before becoming Executive Director of Mended Hearts in 2019. Andrea has been deeply involved in patient engagement efforts since she started, working to assure that their voice is at the table and empowering them to become better healthcare consumers and improve their quality of life through support, education, and advocacy. Perhaps most important, she's a proud mom to 4 children and grandmother to 1, who thankfully all live close by to her and her husband in Pittsburgh. Andrea, thanks to you and your colleagues at the Mended Hearts for being such an enthusiastic and impactful voice for heart valve disease awareness. It's wonderful to be with you today and to present you with the Partner with Heart Award. Congratulations.
Thank you so much. I'm so honored to be here.
Well, fabulous. I want to ask you a few questions about your work at Mended Hearts that you're being recognized for. So let's get started. Okay. Over the past 5 years, both the National Mended Hearts organization as well as many of your chapters have led Heart Valve Disease Awareness Day events. Would you share some of your favorite activities and tell us how you think awareness efforts can ultimately impact health outcomes?
Yeah, so over the past 5 years, we have had some great events. And every year, I think that they're better than the year before. Now, last year, we were excited to be able to have some in-person events and where we had photo booths where everybody took their pictures of the fact that they knew about valve disease and they were raising valve awareness. We also have had health fairs where on Valve Disease Day, we have chapters who have been able to set up tables and booths at their hospital to be able to educate everyone who comes into the hospital. But this year, obviously, we aren't in person, but that doesn't mean we don't have amazing things planned. So we're excited.
And we are excited to see what you do this year as well. I know heart disease is also personal for you. You've been open and speaking about your 3rd child, Trenton, and his experience being born with a congenital heart defect. Please tell us his story and your family's story and what you want families to know, no matter what stage of life they're in, about the value of peer-to-peer connection.
Yeah, so my son was born on St. Patrick's Day in 2009. We did not know that there was anything wrong prior to him being born. So I think while everybody else was drinking green beer and pretending to be Irish, I was becoming a heart mom. It was very scary, very dark and lonely place to be. I spent a lot of days really not understanding or knowing what I was going to do next. And I can remember very clearly that my husband's birthday was in July of that year. And I refused to make a birthday party arrangement because all I could think in my head was, I can't imagine if my son doesn't live, how I'm going to have a birthday party. And that's all I could think about. So I didn't see the end of the tunnel and I could not find my way out of that darkness. I had someone reach out to me who said those amazing words that were, I know how you feel and I've been where you are. And if you have any questions, I'd love to talk to you. And it really was a lifeline to me as a mom. She showed me that there was another side and that this journey wasn't the end. And so that, in my opinion, is really what Mended Hearts is all about. Regardless of what age you come to the heart world, you can find that support and find someone to say, I know how you feel and I've been where you are. And I think that's what makes us really amazing and special.
I think you're right. I think it's so powerful to be able to talk to someone else who knows what you're going through. To that point, you've done a lot in response to COVID-19 as well. So Mended Heart started Visit Me, a virtual peer-to-peer support and education program that allows people to connect via telephone, chat, text, and video from anywhere in the nation. I saw that you offer a discussion community specific to various heart diseases, including valve disease. Tell us a little more about it and how people can reach out and connect.
Yeah, so 2020 was obviously a very amazing year for a lot of different reasons. Here at Mended Hearts, we were able to reimagine what visiting and support looks like, and take it all virtual, even our peer-to-peer support visits, which were typically done in hospital by the bedside. We do about 200,000 patient visits every year. So it was really important for us to make sure that we were able to still connect with patients while they were hospitalized and in quarantine and isolation. So we developed the Visit Me program, and we have been able to distribute 500 iPads into different hospitals and community centers across the nation. And we, do have plans on expanding that. But this technology allows us to have patients reach out to us via video or text, telephone, however they feel like connecting virtually, and have a peer supporter to talk to. We have a Heartline, which is a phone number where people can call and get connected right away to an accredited peer supporter. We have people on staff that are volunteers from 10 a.m. till 6 p.m. Monday through Saturday. And all they have to do is call the hotline and they get somebody to talk to, which I think was really amazing.
I also think that those resources will be used long beyond COVID-19. So it's great that you were able to pivot and get those resources to patients, but I think we'll use them for years to come.
Yeah, absolutely. And we're already finding that, will help in decreasing the disparities where we don't have the ability to be in a hospital. Maybe it's a rural hospital. We don't have chapters there. We don't have members that will be able to connect with people regardless of where their geographic location is.
Absolutely. Can you tell us what have you learned from your work and your family's experiences about heart health, and how do you personally practice heart health?
Well, I loved this question because up until about 6 months ago, I would have lied if I said that I was concerned about my own heart health. I was a busy mom of 4 kids and an executive director of an organization, and really my own personal health and personal care was kind of at the bottom of the list. But I decided last year during quarantine that I needed to really make a change because I needed to walk the walk and talk the talk, so to speak. So I started making sure that I was eating right, making sure it was a heart healthy diet, was getting exercise, drinking my water. And I'm down 40 pounds now since June. And I am actually walking 8 to 10 miles at a time, which was like unheard of 6 months ago. So I think it's really important, but I also think it's really important to stay in care. And Mended Hearts has a stay in care series going on right now because we're finding that people especially during COVID, are not seeking care at their doctors. And especially that proactive care and that preventative care that they need to make sure that their heart is healthy is sometimes being skipped this year because people are afraid to go to the doctor or they don't want to bother the doctor. So we have been doing the Stay in Care series and lots of webinars and education on, taking care of your heart the whole entire year, regardless of the circumstances. I've been to the doctor and I'm making sure that I get my cholesterol levels checked and had a stress test, which the doctor said was A-okay. So I encourage everyone to keep themselves in care.
I think it's admirable that you're encouraging people to get care and reminding people that this is important, but also remembering that as mothers, we often neglect our own heart health and health in general. And so we need to take care of ourselves as well as our loved ones.
Yeah, absolutely. It's so important.
Well, Andrea, thank you so much for your time and your incredible work. And congratulations to Mended Hearts on this much deserved award. We're grateful for your partnership.
Thank you so very much. We are honored and grateful as well. Thank you.